Why history matters. Historical studies are extremely important for nurses everywhere to learn how it shaped current policies and practices that are still in place after all these years. Nursing history is important because it can help nurses everywhere see how the nursing profession started and how it progressed over the years. The book that I chose for my research was American Nursing: A History of Knowledge, Authority, and the Meaning of Work by Patricia D'Antonio. Patricia D'Antonio does a magnificent job on describing how the American nursing progressed since late 19th century. She compiled a great research about some of the most influential nurses in the American history. D'Antonio also showed the progression of nursing throughout the years and how some of the organizations that coordinate nursing practice began their existence. 3 questions were addressed in this poster. The first one was, does historical analysis serve as pedagogy? Historical analysis that supports pedagogy would be the nursing grads were required to live in the hospitals they were training at, which facilitated their education, and they were always available. Doctors realized that the air wasn't making people sick, as it was believed from Florence Nightingale's diaries, and it was actually the hand hygiene that needed to be improved. Isolating contagious patients and having nurses follow a strict isolation policy helped with the spread of infections. Also, the strict nursing dressing code and the strict code of conduct kept the nurses at the highest regard and esteem. Facts that don't support historical analysis as pedagogy would be the doctor's perception that nurses don't need any more education after they graduated, the idea that nurses were too slow when helping physicians with procedures, nurses' knowledge of anatomy and physiology grossly depended on the physician's availability. Most nurses were white, middle-class females. African American nurses were a minority, and male nurses were only trained for the psychiatric wards. The second question addressed in this poster would be the historical analysis as evidence. Nursing shortage was improved by having nursing students oversee patients in the hospitals as part of their nursing training. Public midwives started visiting mothers at home after hospital deliveries to help mothers with breastfeeding and teaching them about common childhood diseases. After the Second World War, Truman legalized the 30-month community college program, which facilitated the nursing shortage after Second World War and also helped students afford a college education. In order to keep up with the nursing demands, the hospital started hiring private nurses for short periods of time while they needed extra staff. The last question addressed in this poster would be history as explanation. One of the most remarkable nurses that started fighting for the nurses' rights would be Elizabeth Jones, an African American nurse who questioned the amount of knowledge and education that nurses had in order to take care of the critical care patients. She campaigned and supported nurses everywhere to receive more education when taking care of sick patients. Another remarkable nurse would be Anne Goodrich, who campaigned to standardize all nursing programs around the country. She also suggested that nursing students who were overseeing patients in the hospital wards should have less patients to look for when they only had a high school education. Lillian Wald was one of the originators of public health nursing. She was also the person who put together the Henry Street Settlement House, which was a public health place for immigrant families and the Lower East Side patients in New York City. In 1946, the American Nursing Association, NAA, and the National Associates of Colored Graduate Nurses, NACGN, joined forces to represent nurses everywhere in the country and fight for their rights and their prerogatives. 10 years later, the National Association of Colored Graduate Nurses dissolved and started operating under the umbrella of NAA. NAA is a legislative body for American nursing, and to this day helps create legislatures and create new regulations for nurses everywhere. This poster shows the history of nursing and how this profession progressed over the years to have the identity that it has today.